your dosage of your examination questions. Okay. So without wasting any more time, today the topic for the high yield discussion would be your endodontic diagnosis. Okay. We'll see the various aspects of the clinical diagnosis of endodontics. So today we shall be talking about the endodontic diagnosis. Okay. See, basically for endodontic diagnosis, we have to ascertain the pulpal condition, or we can say we have to find out the pulpal status of the tooth. Depending upon the assessment of the pulpal status, we would decide what type of endodontic intervention or treatment is required, whether we require a sort of vital pulp therapies like pulp capping, etc., or what is the status of inflammation, and if it has progressed to the irreversible stage, we may require pulpectomy and root canal therapy. That's why making an important diagnosis and exact diagnosis is quite relevant. So pulpal status basically is determined by two category of tests. These are the two primary tests and a secondary test for determining the pulpal status. The first category of test, they are called pulp sensibility test. Pulp sensibility test. Okay. I hope all of you are getting the connection properly. They are called the pulp sensibility test. Let me just check the connection once again. It looks good from my side. Okay. The second category of tests, they are called pulp vitality test. And the third category of tests, which are generally used clinically, are called special tests. These are the three principal types of tests that we employ for diagnosing the pulpal condition or status. As the name indicates, pulp sensibility test, they depend on pulpal nerve supply. Sensations are because of the sensory nerve fibers. So if the pulp is having viable or sensory nerve fibers, what are the sensory nerve fibers present in the pulp? We have already seen they are the A and the C type of fibers. Pulp vitality, they depend upon intact blood supply. Any tissue or organ is said to be vital if it has got active blood perfusion. So the first category of test, which rely upon pulp innervation, intact sensory nerve fibers, they are called pulp sensibility test, and they are of three principal types: the cold test of the pulp, the heat testing of the pulp, and electric pulp testing. All these three tests, they depend upon intact viable sensory nerve fibers, and thus we call them pulp sensibility test. So we'll talk about these tests one by one. The cold test is one of the most common used clinical tests for diagnosing the status of a pulp. Okay. The cold test, what is the principle? How we are able to ascertain that the pulpal status is vital or not vital, viable or non vital based upon the nerve supply. See, the principle is that there is stimulation of A delta nerve fibers by cold application. It is a common experience that whenever we bite upon something very cold, like an ice cream, we feel immediate sensitivity for a couple of seconds. And that immediate sensitivity due to cold stimulus happens due to stimulation of A delta nerve fibers. So the basic principle is that whenever we are applying a cold stimulus to a tooth, if the patient reports sensation like pain, which is the principal sensation carried by the dental pulp, then we can assume that some viable sensory nerve fibers are present in the pulp and it is still not in an irreversibly inflamed state. So, diagnosing the presence of sensory A delta nerve fibers by cold application. And how these A delta nerve fibers are stimulated? They are stimulated by dentinal tubular fluid movement, isn't it? There is enamel, dentine, and then the pulp. So A delta nerve fibers are present in periphery of the pulp. That's why when these fibers which are present in the periphery of the pulp are stimulated by cold application. Now, what are the different agents that I can use for cold application? Simplest of the agent is cold water or ice can be used. Another agent that we can use for cold application is solid carbon dioxide, which is also called dry ice. This solid carbon dioxide is one of the coldest agent with a temperature of negative 78 degrees Celsius. It is so cold that it can stimulate the viable A delta nerve fibers even through a full coverage crown. Full coverage crown means the patient may be having a metal crown, a porcelain fused to metal crown, or a simply metal free porcelain crown. Any of the full coverage crown that is present, this solid carbon dioxide is so cold that it is able to stimulate the underlying A delta nerve fibers, if at all they are present in the pulp. Okay. Then the other agents are ethyl chloride. This ethyl chloride is also called skin refrigerant. It is also called skin refrigerant. Okay. This ethyl chloride or skin refrigerant has a temperature of negative 41 degrees Celsius. It is also quite cold. Another agent that we can use is green endoice. This is a customized testing agent available for pulp testing called green endoice. Temperature of negative 26 degrees Celsius. And it is chemically a compound called 1112 tetrafluoroethane. This compound that is called green endoice, it is used for testing of pulp by stimulation of A delta nerve fibers. So you have to basically remember that whenever we talk about cold testing of the pulp, the target is viable A delta nerve fibers, and how these A delta nerve fibers would be stimulated. They would be stimulated by dentinal tubular fluid movement. There would be no direct stimulation of A delta nerve fibers. Okay. Now, what is the testing protocol? No matter what type of pulp sensibility test we are using, whether the cold test or the heat test or the electric pulp testing, the protocol has got three cardinal steps, three principal steps that remain the same. What are these steps? The first one is we have to test adjacent and contralateral teeth first. What is meant by adjacent and contralateral teeth? Suppose we have to look for the pulpal status of our mandibular right first premolar. We would be testing the canine and the second premolar, means the adjacent teeth, and the first premolar of the opposite side, means the contralateral teeth. These should always be tested first before applying the testing agent to the offending or the tooth which is suspected of having a diseased pulp. Why? Because we are relying upon sensory nerve fibers and every patient has got a different pain threshold. So what is the baseline response? We have to ascertain by applying the cold testing agent to some normal tooth. Normal tooth can be several adjacent and contralateral teeth. So this is the basic principle of pulp testing with pulp sensibility methods. Okay. And it is applicable to all the three: heat test, cold test, and electric pulp testing. So what is the purpose? To establish baseline response. How a particular patient would respond to a particular testing agent. The second cardinal principle that is to be followed is isolation under rubber dam. When we are testing the pulpal status of a particular tooth, the stimulus should be applied onto that tooth only and not to any other adjacent tooth. So isolation of that particular tooth is important so that we do not get false readings from the adjacent teeth. And the third principle is direction of testing. For each quadrant is always from posterior to the midline or posterior to the anterior. In each quadrant, we would test the teeth from posterior to anterior because to follow the natural direction of innervation of the teeth, whether the maxillary or the mandibular, they are innervated from backwards to forward. These are the three principal steps to be followed. Then the fourth step would be the agent application. Means whatever cold testing agent we are using, we have to apply that. Regarding the agent application, two things we have to remember. What would be the site of application of testing agent and what would be the duration of application. Okay. If we talk about site of application, it should be the mid facial area of the tooth. This is a tooth, anterior tooth. This is a posterior tooth. The agent has to be applied onto the mid facial area of the tooth being tested so that maximum possible stimulation of the viable A delta nerve fibers occurs. And the duration, maximum, we have to apply for 15 seconds. Beyond that, there are chances that there would be cold injury to the pulp. Our purpose is to determine the status of the pulp and not to damage the pulp. Okay, so the maximum duration should be 15 seconds. And this midfacial area is chosen and the agent is applied with a large number 2 cotton pallet. There is a cotton pallet. It is saturated with the agent that we have to use, cold testing agent, and this is applied onto the mid facial area of the tooth being tested. This is how we do the cold testing of the tooth. Now, what is the result we can obtain? Cold testing is the most accurate method. Pulp sensibility test. Most accurate sensibility test. Okay, I'm not talking about the vitality test, I'm talking about sensibility test. So out of the three sensibility tests, cold testing is the most accurate, and there can be a clinical situation like patient's pain is relieved on cold application. What is happening? The patient reported to your practice with cold application that is giving you, means the patient said, I have been drinking ice cold water throughout the night to relieve the pain, or the patient carries the bottle of ice cold water placed against the cheek so that the pain is relieved. Similarly, what is happening whenever we are doing the cold testing and you have applied the cold testing agent, the patient's pain is relieved on cold application. Normally, what happens whenever something very cold is applied, we would feel pain due to stimulation of A delta nerve fibers. Now, the reverse is happening. A very cold agent is being applied, but the patient's pain is relieved. Then the diagnosis would be advanced, irreversible pulpitis, or sometimes we also call it pulp necrosis. Okay, this is the only clinical condition that can be accurately diagnosed with cold application, and the result can be very straightforward. Cold application relieves the pain, means it is a case of advanced irreversible pulpitis or pulp necrosis, and we have to do root canal therapy. Coming over to the second sensibility test, that is the heat test. What would be the principle of heat testing? Now, we all know that heat is more damaging as compared to cold. So what would be the principle? There would be stimulation of C fibers due to heat application, and the patient would feel pain. Previously, we have discussed the structure and functions of dental pulp, and we have seen whenever we talk about sensory innervation of the pulp, only two type of fibers you have to remember, the A fibers and the C fibers. So whenever heat application is there, temperature greater than 110 degrees Fahrenheit, there would be stimulation of pulpal C fibers and the patient would feel pain. That is the basic principle. Now, what is the difference from cold testing? There was a stimulation of A delta fibers. With heat testing, there is a stimulation of C fibers. This is the fundamental difference there. If we talk about what all can be used, heat testing agents, we can use hot water. We can use a rubber wheel. Rubber polishing wheels are there for restorations. Okay. We can rotate that wheel against the tooth that generates frictional heat and result in stimulation of viable C fibers. We can use heated gatta parcha stick. What is gatta parcha stick? It is the same gatta parcha that is used for obturation. We can heat it, and there's a stick of gatta parcha available, heated on the flame. When it softens, the temperature is sufficient to stimulate the viable pulpal C fibers. Okay, what is the protocol? The protocol for heat testing remains the same. The first, second, and the third steps would be the same as I have discussed for cold testing. Means isolation under rubber dam, testing of adjacent and contralateral teeth first, and direction of testing would be from posterior to anterior for each quadrant. The fourth step comes agent application. Where do we apply the heat testing agent? The site of application remains the same, that is the mid-facial area, as we have seen for cold testing. Mid-facial area of any tooth. And what is the duration? Now we all know that heat is more damaging as compared to cold, and so maximum duration should be 5 seconds application. This is maximum. If no response is being generated, we usually switch over to another testing method. What are the results of heat testing? The problem with heat testing is that there is no clinical condition that can be accurately diagnosed with heat testing. So it is considered to be the least accurate sensibility test. So what is this most accurate sensibility test? The cold testing, and the least accurate one is heat testing, and no clinical condition can be accurately diagnosed. It is most useful in situations where the patient reports pain due to heat. And whenever the patient says that I have got pain with hot drinks like hot coffee, tea, or other hot beverages, that it indicates that some degree of pulpal inflammation is there, which is causing the intrapulpal pressure to rise. And whenever the patient takes something hot, the intrapulpal pressure rises further and it aggravates the patient's pain. But to what extent the pulp is inflamed, we cannot determine with heat testing, and that's why it is called the least accurate pulp sensibility test. Okay, we come over to the third, that is electric pulp testing. This electric pulp testing, as the name indicates, would be using an electric pulp tester. Electric pulp tester is a device like this. It is a handheld battery operated device with a probe tip that is placed onto the tooth. So what is the principle? Now, the principle would be either of the two, the A delta or the C fibers. Here, what is the target? Is again A delta fiber stimulation, just like cold testing. Okay. What are the agent? There is just one agent, that is electric pulp tester that is used. What is the protocol for testing? The first three steps, they remain the same. I have already told you they are the same and essential steps for all sorts of pulp sensibility testing. What are the steps? We'll have to do the adjacent and contralateral teeth testing, isolate the teeth under rubber dam, and the direction of testing would be from posterior to anterior in each quadrant. Agent application, or we can say electric pulp tester application. The general rule is that we have to apply in areas of highest neural density. Neural density means the A delta nerve fiber density. And from the basics of dental anatomy, you must be knowing that if we talk about anterior teeth in the pulp horns, means at the incisal edge, we have got the highest neural density. And similarly for posterior teeth, the pulp horns are present below the cusp tips. So these are the two areas where we apply the electric pulp tester, the cusp tips for the posterior teeth and the incisal edges for the anterior teeth. Out of the cusp tips, from again the knowledge of anatomy, the mesiobuccal cusp tip is selected because it has got the highest pulp horn, least thickness of enamel and dentine above the pulp is there. So we would be getting the maximum response. So which cusp? Mesiobuccal cusp is selected. Okay. And what are the results? It has got intermediate accuracy. Most accurate is cold testing, then electric pulp testing, and then the heat testing. Least accurate one. If we talk about the electric pulp testing, there are incidents of false negative results and false positive results. What is the meaning of false negative? Means the pulp is having viable nerve fibers, but the electric pulp tester is producing no response. The patient is not giving any response, even though the pulp has got viable nerve fibers. False negative. And the reverse, false positive results means the pulp is actually necrotic or degenerated, but still the patient is reporting pain due to electric pulp tester application. Some common clinical situations for false negative results means it is not responding, although it should respond, are immature teeth. Teeth with open apices. They do not respond to electric pulp testing because the A delta nerve fibers are the last principal fibers to mature in a developing tooth. Then we have got recently traumatized teeth. A tooth that has undergone recent trauma, the peripheral nerve fibers, like the A delta nerve fibers, are in a state of paresthesia, and application of electric pulp tester would not produce any pain, even though the pulp is viable. Okay. Other situations for false negative results means the pulp is not responding. Ideally, it should respond to electric current. Means teeth with thick bases. We all know that bases are poor conductors of electricity. So a tooth that has been restored with thick bases, the electric current would not go to the pulpal nerve fibers, would result in false negative results. And then we have got sedated patients. Patients can be under the influence of drugs or alcohol. Altered sensations are there. They do not respond to electrical testing as frequently as normal patients. False positive results can happen in cases of moist gangrenous pulpitis or moist gangrenous pulp. The pulp is degenerative, necrotic, but it is a moist gangrenous pulp which is containing electrolytes and salts. So the current is being conducted to the healthy periapical tissues and the patient reports pain, and we assume the pulp to be vital. False positive results. The most common reason is apprehensive patient. Apprehensive patient. Patient is having some sort of fear. Even the just simple application of the electrode, the patient would give a sensation of pain. Apprehensive patient. Then we have got improper tooth isolation. If we do not isolate the tooth, the current can be conducted to the adjacent healthy tooth and the patient would report pain and we would falsely assume the pulp to be viable. So these are some of the clinical conditions that give rise to false negative and positive results. There is actually no need for you to just cram them. You can just understand what is false positive and false negative, and you would be having anyways 4 options in any question. You can look at the options and answer whether it is a false positive condition or a false negative condition. So these are the pulp sensibility test. The second category of tests are vitality test. They are the real pulp tests. Means they are the real indicator of the status of pulp, whether the pulp is vital or non-vital, because it tests the presence or absence of active blood circulation in the tooth. The first test is LDF, that is laser Doppler flowmetry. See, laser Doppler flowmeter is a device that is used in the medical practice basically to find out the blood circulation in the microvasculature. Microvasculature is present in the retina of the eye, in the cortex of the kidney, and in the intestinal mesentery. Okay, and same device we can use to see the perfusion of blood in the dental pulp. So the application of laser Doppler flowmeter, it was firstly reported for dental practice in the year 1986 by Gezelius. Gezelius. He introduced it for diagnosing pulp status. Laser Doppler flowmetry. What is the principle of laser Doppler flowmetry? It works on Doppler's shift principle. In your school physics, you must have read about Doppler's shift. Okay, in the day-to-day practice also, on the roads we have got traffic police interceptors. Okay, basically these traffic police interceptors know the speed of your vehicle from a distance. Similar thing is happening. The Doppler shift means whenever we strike light onto a fast moving object, the frequency of the light is Doppler shifted. So particular wavelength of light would be reflected from a moving object and it would Doppler shifted. How much is Doppler shifted depends upon the velocity of the object. So we are using a laser to test the vitality of the pulp. Which laser is used? Usually we use helium neon laser of 632.8 nanometer wavelength. This is a red laser. Near infrared laser, a red laser is there. 632.8 nanometer. If this is the vascular bed that we have to test, we know that in the blood there are numerous red blood cells that move at a fast speed in a particular direction. So whenever the light is fired if there are viable RBCs present in the circulation. They would be Doppler shifted and it is read with a photodetector. This is the working principle of your laser Doppler flow meter. Which laser is used? The red laser, that is the helium neon laser, and it works upon Doppler's principle. Greater the amount of RBCs present moving at fast speed, greater would be the Doppler shift of the wavelength of light. Okay. What are the advantages of this laser Doppler flow meter? It is the most accurate pulp testing method. This gives an accurate indication of the viability of the pulp, whether it is vital or non-vital, because it is not relying upon the nerve fibers, but on the presence or absence of blood circulation. Secondly, these tests are purely non-invasive. We are not applying any heat, cold, current. Okay. They are purely objective tests. Objective means we do not have to depend upon response from the patient. Okay. No matter what is the condition of the patient, if the patient is apprehensive, the patient is sedated, the patient is comatose, whatever is the situation, we can do this testing accurately to find out the pulpal status. Okay. So the principle of testing the adjacent and contralateral teeth first does not apply to these vitality tests. There is no need actually, because we can directly apply them to the tooth under suspicion and gauge the status of the pulpal condition. If we talk about the disadvantage, the most important disadvantage is that it can be used only on natural teeth. Means if the tooth is having a full coverage crown, we cannot use laser Doppler flowmetry because the laser would not be able to penetrate the full coverage crown and go to the pulp. Secondly, poor isolation of teeth. Can result in false results because the laser light can be reflected from adjacent tissues like gums that are present around the teeth. Okay. We are firing a laser light. Instead of being reflected from the pulpal circulation, if the teeth are not isolated, that light can be reflected from gingival circulation, and we can falsely assume the pulp to be vital. Okay, that's why isolation is important. And the third disadvantage is that there is no customized dental equipment. We are using that same machine that is available in the medical practice for the other parts of the body. So till that, there is no, I would say, customized dental equipment available in the market. That is a disadvantage. The second method of pulp vitality testing is pulse oximetry. You are familiar with the term pulse oximeter, which has become a household name since the onset of COVID. We all have used it. A device that clips onto the fingertips and assesses the blood oxygen saturation level. This is known as pulse oximeter. The same pulse oximeter is used for diagnosing the status of blood circulation in the pulp. Pulse oximetry. This pulse oximetry is based on which principle? It is based upon Beer-Lambert law. The Beer-Lambert law. What was the principle of laser Doppler flowmetry? Doppler's principle. These are physical principles. The details of these principles are not required. Simply you have to remember what are the working principles. So I have talked about the pulp sensibility tests, heat test, cold test, electric pulp tester. I have told you about the working principles. How do they actually work? We have seen laser Doppler flowmetry. its principle. We have seen pulse oximetry and its working principle. Now, this also uses lasers. Two laser lights are used for pulse oximetry, red and infrared laser. The red light has a wavelength of 640 nanometers and infrared light has a wavelength of 940 nanometers. This is a vascular bed that is being tested. From one end, the two lasers, the red and infrared, are fired into the vascular bed, and depending upon the presence of oxy and deoxyhemoglobin, isn't it? Blood would be consisting of two type of hemoglobin, oxy and oxyhemoglobin. The amount of light that comes out from the opposite side is read by a photodetector. Okay. If you remember, pulse oximeter is a device that clips onto the finger. So from one end, the light is being fired, and from the other end, it is read by the photodetector. And how much of the red or the infrared light would come out from the opposite side depends upon the amount of oxy and deoxyhemoglobin. So basically, it gives an idea about the blood oxygen saturation level. Okay. So its working principle is different from that of laser Doppler flow meter. Laser Doppler flow meter was directly assessing the presence of RBCs. Here it is talking about blood oxygen saturation, and more the oxygen saturation, more would be the vitality of the tissue. This is how it works. If we talk about the advantages of this method, that is pulse oximeter, definitely it is an accurate method of diagnosing the pulpal status, but less than laser Doppler flow meter. Okay. This method is also non-invasive. No heat, cold or current is applied. This method is also purely objective, entirely in the hands of the clinician to conduct and assess the results. These are the advantages of pulse oximeter. So these are the two pulp vitality tests. Now there are certain clinical conditions where direct application of a sensibility and a vitality test does not give you a conclusive evidence of the pulpal status. In such situations, we apply special tests of the pulp. Okay, special testing methods. The special testing method, the first one is called the bite test. This bite test is used to diagnose cracks in the tooth. What are cracks? Cracks are incomplete fractures. Okay. If there's a tooth like this and there is a crack that is not noticeable clinically, and the patient is reporting pain while mastication of other things, then we can suspect a crack. There is no caries in the tooth. There is no radiographic changes in the tooth, but still the patient is reporting pain or sensitivity in a particular tooth. Then the likely cause can be a crack. This crack is an incomplete fracture because there is no loss of tooth structure. We cannot see it clinically. In such situations, bite test can be useful. What instrument we use to conduct a bite test? The device or the instrument used is called tooth sleuth. Tooth sleuth. This is also called frac finder. Tooth sleuth of frac finder. This is a plastic device with a handle and a testing pad. There is a central cupped out area. When we see the device from the top, it is just like this, a very simple plastic device. When we see it from the side, it looks like this. So there is a central cupped out area. We place this cupped out area against the cusp being tested, one cusp at a time. This is the opposing tooth, and we ask the patient to bite upon it. Okay. This cupped out area is placed against one particular cusp and the patient is asked to bite upon. When the patient reports pain on release of pressure, okay, the patient bites down, there is no pain, but when the patient lifts up, there is pain. It is a suspicion that there's crack in the tooth. Why there would be pain on release of pressure? Because when the patient releases the pressure, there is microscopic movement of tubular fluid along the crack that causes stimulation of A delta nerve fibers and the patient feels pain. So pain is during the release of pressure is the diagnosis for crack in the tooth. The second special test is called staining and transillumination. This is also used for diagnosing cracks in the tooth. Another one is the bite test. Another is staining in transillumination. Staining means, can there be something that when I bathe the tooth into that, the cracks would become conspicuous or visible clinically? We can use dyes for that. That is 1% methylene blue dye. We wash the tooth with methylene blue dye, leave it for a couple of seconds, and then rinse it off. This dye would be undertook by the crack and it would be visible clinically. In transillumination, we use white fiber optic light. Okay. What is happening? Suppose this is a tooth crown that has got a crack that is not noticeable clinically. We show intense white fiber optic light from one side of the tooth and the operatory is dark. Means we switch off all lights in the operatory, including the dental chair light. It's like a dark room used for developing the x-rays. The only light present is the light that is illuminating the tooth structure. So the part of the tooth structure that is close to the light source, it would appear light or illuminated. And because of presence of fluid in the crack, there is a microscopic crack that would be containing fluid. The light would not pass or transmit through the crack and the distal part would appear dark. This is the principle of transillumination to find out the cracks in the tooth. So what is the reason why the light is not able to cross the crack? Because of presence of fluid in the crack. This is the principle of transillumination. The third test that is used is anesthetic test. Anesthetic test. As the name indicates, anesthetic test, we would be administering anesthesia. At times, the patient reports with pain, and the patient initially and the clinician also cannot zero in whether the pain is coming from the maxillary tooth or the mandibular tooth. Simply, the patient is reporting pain on one side of the face, whether the right or the left, and the initial examination does not reveal any offending tooth, and we are not able to find out whether the pain is coming from a maxillary tooth or a mandibular tooth, or it is a non-odontogenic cause of pain. In such situations, we can use anesthetic test. So what is the primary indication? When pain cannot be determined to be coming from whether maxilla or mandible. Okay. In such situations, we use anesthetic test. What is done? We give inferior alveolar nerve block to the patient on the side of the face being reported having pain. If the pain is relieved, then of course, what would be the offending tooth? It would be some mandibular tooth. If the patient's pain is not relieved, then we give maxillary infiltration. Okay. On the same side, posterior superior, middle superior, anterior superior, by ways of maxillary infiltration or individual nerve blocks. There can be two situations. The patient's pain is relieved when we give maxillary anesthetic injections. Then the offending tooth is a maxillary tooth. Second situation can be there, the pain is not relieved. Okay, the pain is not relieved. Then it would be a non-odontogenic cause. Definitely, when even after blocking the innervation of both the maxillary and the mandibular teeth, the pain on that particular side of the face is not being relieved, we can suspect a non-odontogenic cause that can require further investigations. We are focusing upon the odontogenic causes. So in situations where the arch of the tooth responsible for the offending tooth is not being identified, in such situations we can give selective anesthetic testing. So this is the indication for this test. And the fourth test is called test cavity. This is the special test that is considered to be the last resort test. It is considered to be the last resort test. Last resort test means when all other testing methods have failed to give a conclusive evidence about the pulpal status, we use the test cavity. Why it is the last resort? Because it is an invasive test that causes irreversible damage to the tooth structure. What is done in this test? Suppose this is the tooth of which we have to determine the pulpal status. We would start preparing a class 1 cavity with a small round burr into the tooth. Okay, we use number 2 or number 4 round burr, diameters of 0.5 to 1 millimeter, and no anesthesia is given to the patient. We start preparing a cavity and go on increasing the depth of the cavity. A small class 1 cavity is being prepared. As we reach the dentino-enamel junction or slightly below it, if the patient feels pain, means there are viable nerve fibers, the pulp is considered to be viable or vital, and the tooth is restored. If there is no pain, even when deepening the cavity of the tooth is done, then the pulp is considered to be non-viable, and we proceed for root canal treatment. Why this is considered to be the last resort? Because we are preparing a cavity in a tooth of which the pulpal status is yet unconfirmed. Suppose the patient reports pain and we have to restore the tooth, and irreversible loss of the tooth structure has already occurred. So this is the last resort of pulp testing, that is the test cavity. And what is important, that no local anesthetic is given so that any pain sensation related to the tooth can be reported by the patients. These are the 4 special tests used for the pulp status. So these are the basics of your endodontic pulp testing methods. Okay. With this, I conclude today's session, and an important information for you all guys, that we are making all efforts to make your journey to MDS a smoother one. So in line with that, on 23rd of June, that is coming Monday, we have got a career counseling session at the DAMS head office in Delhi. All the interested candidates, they can make up and ask personally their queries, whatever related to the counseling, etc., what all branches they need to select, what are the good colleges. So it would be a personal one-on-one interaction on 23rd of June, that is coming Monday. The timings would be 12 to 4 p.m. Please make sure that you go there, and definitely it would be a interactive, informative session, help you in choosing your decisions wisely. Thank you very much for being connected with me. With this, I am signing off. See you again next month in another interesting subject and topic. Till then, happy reading. Goodbye, everyone. Take care.